I'm really excited to present the phase 2 TRADE study at ASCO 2025 this year. Just as some background, abemaciclib is an oral CDK4/6 inhibitor, and this drug has a very important role in the management of high-risk node-positive, hormone receptor-positive, HER2-negative early breast cancer because it can reduce the risk of breast cancer recurrence. However, therapy with abema can be complicated by toxicity, and this can reduce a patient's ability to receive maximum benefit from the medicine. There are some experiences with other novel therapies that use an initial dose escalation strategy to try to help reduce toxicity and prevent drug discontinuation. So this is why we designed TRADE, which is, again, a prospective investigator-initiated phase 2 study to see if using this dose escalation with abema could help improve drug tolerability and reduce discontinuation. Eligible patients for the TRADE study were patients who were already candidates to receive adjuvant abemaciclib. These patients started at a low dose of 50 milligrams twice a day for 2 weeks, and then, if they were doing okay without significant ongoing toxicity, escalated to a middle dose, 100 milligrams twice a day for 2 weeks, and then escalated to the target dose, 150 milligrams twice a day moving forward. The primary endpoint of the study was a composite adverse event rate that we measured at 12 weeks. This included discontinuation of abemaciclib, inability to reach the target dose, or inability to maintain the target dose. And the study was designed to demonstrate a significant improvement in this adverse event rate compared to what was seen in the registration monarchE study. So we enrolled 90 patients at Dana-Farber, and of these patients, 70% were able to reach the target dose using the dose escalation strategy. 26 of the patients, or 29%, did meet the primary endpoint, but this was a significantly lower number than was seen in monarchE. So this suggests that the dose escalation strategy improved outcomes. We also noted in our data that for patients who were unable to reach target dose, that most of them were able to continue at one of the lower doses, and only a very small percentage had to stop early. So in summary, our study, TRADE study, suggested that using the initial abemaciclib dose escalation strategy allowed the majority of patients to reach and maintain target dosing by 12 weeks, and only very few patients had to discontinue therapy.